All right, guys. Welcome to the first training for the month of April. So for April, we have 4 classes, and this is the first class for the month of April, where we intend to teach pharmacy sales staff how to manage headache, right? Because headache is the very most common um, complaint. How your man complain, right? Headache is everyone comes in with headache, right? So who are very important for you guys to be able to understand headache and be able to treat it. And finally, be able to figure out pé ìgbà wo ló yẹ kí pharmacist kó kẹ́ refer sí pharmacist and ìgbà wo lè ẹ̀yin fúnra yín lè treat headache, right? Because wrong advice can cause harm, right? So what is headache? Headache is the pain in the head, in the scalp, or in the neck, right? So we've all had headache and we know what headache is. What is your role as a staff? Is that number one, you need to be able to ask questions. Number two, you need to be able to identify which type of headache it is. Number three, you need to be able to recommend OTC, paracetamol, ibuprofen, and then you need to be able to know when to refer, all right, to the pharmacist. Now, key questions tó yẹ kẹ́ ẹ máa bẹ̀rẹ̀ ni pé number one, ibo ni orí yẹn ti ń fọ́ yín? Is it in the front of the head? Is it in the middle of the head? Is it at the back of the head? Is it in the nose? Is it in the eyes? Lẹ máa fi mọ which type of headache it is. Then the duration, ẹ máa béèrè, you would ask, how long has this headache been worrying you? Ṣé àárọ̀ ló máa ń ṣẹlẹ̀ ni? Does it happen in the afternoon? Does it happen at night? How long? Some people will have headache, they will sleep and wake up and the headache has gone, right? You also need to ask what other symptoms do you have, and then what is your medical history, right? So at the end of this class, you need to be able to do two things because you will be tested on two things, right? You need to be able to identify all the different types of headache, and you need to be able to identify how to treat those types of headache, right? So your assessments will be on these two things, and there's prizes for best performing staff. There's prizes for it. So first and foremost, what are the different types of headache, right? Depending on the location of the headache, you need to know what type of headache it is, right? The first one is the most common headache. Tó máa ń pè ní tension headache. That's the one you know. The one that happens in front of the head, right? That's tension headache. Now, when the customer now says, imú mi, ojú, front of the head, and even the ears, right? When headache comes from the lungs, to the nose. Tó bá wà around the nose, then it's called a sinus headache. If the headache is happening on one side of the head and is very painful, right, towards the ears, migraine here, right? And then the final one is the cluster headache. This one happens around the eyes. So forget about these two, right? Forget about occipital neuralgia and hypertension headache. That one happens at the back of the head. Fún àwọn àgbàlagbà that will say, orí yẹn fọ́ mi lẹ́yìn, you already know that hypertension headache ni. But forget about this one, right? So let's go into it. So tension headache, number one, is the normal one that happens in the front of the head that you know, right? Kí ni cause ẹ̀? Stress, right? Vitamin deficiency, ó máa ń fa tension headache. So when people come for tension headache, you can prescribe multivitamin for them. Genetics tún máa ń fà, right? For some people, headache yẹn máa ń wà ní ìran wọn in their family. And then food. I know someone that doesn't drink garri, cassava, depending on your blood group and genotype. There are some foods that some people should not be eating, no matter for headache food, right? So for some type of blood group, tó bá jẹ cassava products, garri, anything cassava, ó máa ń jẹ́ kó ní orí fífọ́. The location is the front of the head, right? Location is the front of the head. How do you treat it? Paracetamol, NSAIDs like ibuprofen, tell them to rest and hydrate. Anything more than that, you refer to the pharmacist. Migraine is a throbbing pain on one side, right? When people are now saying the headache worsens, tó bá ti rí oòrùn, they see the sun, the headache worsens, you already know that it's light sensitivity, that's migraine. Ìgbà míì, it used to make them want to vomit, right? So again, let me show you. On the one side of the head towards the ear, right? Once there's light sensitivity and there is nausea, you already know that it is migraine, right? How do you treat migraine? Paracetamol, ibuprofen. There is a class of drug we call triptans, like sumatriptans, right? Then, alternative therapy like hydration, drinking water, supplements like magnesium and vitamin, and then after this you refer. So that's number two. Number three is the sinus headache. Like I said, once it's getting towards the eyes and the nose, right? The nose area is what is called the sinus region. So once person says that what affects the me, you already know that it's sinus headache. So how do we know sinus headache? Pain around the eyes blocks nose and facial pressure. Once it's coming down towards the face, you already know that it is a sinus headache. How do you treat sinus headache? You give paracetamol. You can give decongestants like pseudoephedrine and phenylephrine. Then there are topical agents like oxymetazoline, nafazoline, and xylometazoline. Finally, we also give antihistamines like diphenhydramine. There is a combination with paracetamol, chlorpheniramine, and doxylamine. You can also give cetirizine or loratadine for sinus headache. There's something called dehydration headache. So once they say, oh, I feel tired, when there's fatigue around roomy, right? And they have complaint of dry mouth, then you already know that is dehydration headache. What they need is water, ORS, and paracetamol. Then finally is cluster headache. Let me go back. Cluster headache is towards the eyes as well, right? It can start from top of the head, but it happens towards the eyes, right? So one side of the head behind the eye radiating to the top of the head, right? So from the eyes to the top of the head is cluster headache. I know we've not talked about top of the head headache. Front of the head headache is what we've talked about. So once you're hearing top of the head to the eyes, it is cluster headache, right? People who walk in front of screen for a long time, common for cluster headache. So what do? You rest your eyes, you reduce screen time, you can give paracetamol as well. Right. So what drugs do we use to treat headache? Usually paracetamols, NSAIDs like ibuprofen, naproxen, and diclofenac. And then we have combination therapy as well. What not to do? Don't prescribe an antibiotic, right? Don't ignore the red flags and avoid overdose, right? The red flags that you're not ignoring is sudden pain if it just started, if it's if the headache comes with fever, if the headache comes with vision loss, or if the headache comes after injury, please refer, right? So identify, check the red flag, and refer. So that will be the end of this class.